Hello, this is Janice, and for the next hour, I'll be reading from the May issue of Healthy Living on the Niagara Frontier Radio Reading Service. Spring allergies, what you need to know. As winter ends and flowers start to bloom, many people look forward to spending more time outdoors, only to face the unwelcome arrival of spring allergies, also known as seasonal allergic rhinitis or hay fever. Spring allergies are among the top reasons patients visit their primary care provider this time of year. Knowing the signs, treatment options, and when to see a specialist can help you manage symptoms more effectively. Signs and symptoms. Spring allergies are triggered by pollens from trees, grasses, and other plants. Common symptoms include sneezing, runny or stuffy nose, itchy or watery eyes, itchy throat or ears, postnasal drip, fatigue, often caused by poor sleep due to congestion. While these symptoms can resemble a cold, allergy symptoms tend to last longer, develop quickly, and do not include fever or body aches. Common treatment options. Primary care providers often recommend a combination of medications and lifestyle adjustments. Antihistamines, for example, cetirizine, loratadine, help manage sneezing, itching, and a runny nose. Intranasal corticosteroid sprays are the most effective treatment for nasal congestion and inflammation. Nasal saline rinses can clear allergens from the nasal passages. Decongestants can provide short-term relief, but should be used with caution. Allergy eye drops can help soothe itchy, watery eyes. Starting medications before peak pollen season often results in better symptom control. Things to avoid during the peak allergy season. You can minimize exposure and stay more comfortable by limiting outdoor activities on days with high pollen counts, keeping windows closed both at home and in the car, showering and changing clothes after going outdoors, using air purifiers equipped with HEPA filters, avoid outdoor yard work if possible, or wear a mask doing it. These changes can significantly reduce the pollen you inhale or bring into your living space. When to see an allergy specialist. A primary care provider may recommend seeing an allergist if your symptoms continue despite proper treatment, you are seeking confirmation of particular allergy triggers, you are considering allergen immunotherapy or allergy shots or drops, you have frequent sinus infections or asthma that worsens during allergy seasons. Allergy testing, usually skin or blood testing, can help determine your triggers and create a more personalized treatment plan. Buffalo Medical Group Primary Care is open to new patients at all locations. Call 716-656-4471 to make an appointment. Rising prescription costs. Simple ways older adults can stay healthy and spend smarter. As we age, prescriptions often become part of everyday life. Medications help manage common conditions such as high blood pressure, diabetes, heart disease, and arthritis. While these treatments help people stay active and independent, they can also strain monthly budgets, especially for those on a fixed income. Rising healthcare costs can be frustrating for everyone, and for older adults, prescription medications are often a significant and ongoing expense, says Mona Chitre, PharmD Univera Healthcare's Senior Vice President and Chief Pharmacy Officer. The encouraging news is that a few simple, proactive steps can help keep prescription costs manageable while still protecting your health. Taking medications as prescribed. It can be tempting to stretch a prescription or skip a dose when costs feel overwhelming, but doing so can lead to bigger problems later. Taking medications as prescribed is one of the most effective ways to avoid higher costs down the road, Chitry says. Skipping doses or stopping medications for chronic conditions can be dangerous and may lead to complications, such as disease progression or result in an emergency room visit or hospitalization, both of which carry even higher costs. Your pharmacist is a valuable resource. Pharmacists can answer questions about how to take medications safely, explain possible side effects, and identify interactions between prescriptions. They can also help identify lower-cost alternatives that work just as well, which you can then discuss with your doctor. Some health plans offer medication reviews for people taking multiple prescriptions to help ensure their medicines work well together. Check with your health plan to see what support programs are available. Making budgeting easier. Prescription expenses may fluctuate throughout the year, making budgeting difficult. For people enrolled in Medicare Part D, some health plans offer options that spread prescription costs into predictable monthly payments, rather than larger one-time expenses. While these options do not reduce the total cost of medications, they can make planning for expenses easier and help avoid surprises. Check with your health plan to see what support programs are available. Compare prices and look for savings. Many people are surprised to learn that prescription prices can vary by pharmacy. Comparing prices at nearby pharmacies and discussing more affordable options with your prescriber or pharmacist are simple steps that can add up to significant savings over time. There may also be assistance programs that help reduce out-of-pocket costs. In New York State, eligible seniors may qualify for the Elderly Pharmaceutical Insurance Coverage, or EPIC program. At Universal Healthcare, we have an online tool for Medicare members to compare prices at of their prescriptions at local pharmacies. Chitra says, checking eligibility for EPIC and enrolling can make a noticeable difference. Rising prescription costs are a reality, but staying proactive makes them more manageable. By asking questions, using available resources, and checking with your pharmacist and health plan, older adults can focus more on enjoying a healthy, active life. 7 benefits of socialization for seniors. One of the primary lessons learned during the COVID-19 pandemic was how isolation contributes to poor mental health. Experts say it is important for adults to maintain an active social life as they age, noting the many benefits of staying engaged and socializing with others. The following is a look at 7 ways socialization benefits seniors. Number 1, Regular social interactions can help older adults avoid depression, anxiety, and feelings of isolation. 2. Social engagement can help reduce the risk of cognitive decline and dementia because socializing helps keep the mind sharp. 3. Socialization often revolves around an activity that gets seniors up and moving. While being sedentary is fine on occasion, consistently sitting or lying around can lead to high cholesterol, weight gain, and high blood pressure. A 2019 study in the Journals of Gerontology determined that older adults who interacted with people beyond their usual social circle of family and close friends were more likely to have higher levels of physical activity, greater positive moods, and fewer negative feelings. 4. Regular social interaction may compel seniors to embrace healthier eating habits. Social events expose seniors to different types of food, helping them to get the nutrients they need to live healthy lives. 5. Regular socialization can help seniors feel needed and provide a sense of purpose, which can boost self-esteem. 6. Getting out and interacting with others can serve as an informal wellness check, alerting family and friends to issues that may need attention. 7. Getting outside and interacting with others can open seniors up to new hobbies. Socialization is an important factor in seniors' overall wellness and one that should be discussed along with diet, exercise, and illness management. Common warning signs of arthritis. Everyone is familiar with the term arthritis, including those who are not affected by it. However, few people understand what it is. Arthritis is not a simple disease, but an informal term for joint pain or joint disease. In fact, the term arthritis refers to more than 100 types of conditions. According to the American Arthritis Foundation, there are 4 important warning signs of arthritis, regardless of which type a person may have. Pain. Arthritis-related pain may be consistent or intermittent. Arthritis pain can occur at rest and is not always triggered by activity involving the affected joint. Pain from arthritis can be localized to one area or affect multiple parts of the body. Swelling. Skin over the joints affected by arthritis may become red and swollen and feel warm to the touch. Anyone experience this swelling for 3 days or longer, or more than 3 times per month, should contact a physician. Stiffness. Stiffness upon waking in the morning or after prolonged periods of inactivity, such as sitting at a desk during the workday or taking a long car ride, can be a sign of arthritis, especially if the stiffness lasts an hour or longer. And difficulty moving a joint. People who experience difficulty moving, such as when getting out of bed, may have arthritis. People who recognize any of these warning signs should report them to their physicians immediately. Be as specific as possible when describing these symptoms, as specificity can help physicians design the most effective course of treatment. You are listening to a reading of articles and features from Healthy Living on the Niagara Frontier Radio Reading Service. risk factors for stroke, including those you can control, courtesy of the American Heart Association. The likelihood of knowing someone who has had a stroke underscores how prevalent stroke is and how important it is to understand stroke risk factors. According to the World Stroke Organization, more than 101 million people, including men, women, and children, have experienced a stroke. No one is immune to stroke, but the American Heart Association says it is important to be aware of both the risk factors you cannot control and those you can. Risk factors you cannot control. Age. Stroke is more common among both men and women ages 65 and older. Family history. Having a parent, grandparent, sister, or brother who has had a stroke places individuals at a higher risk. A family history is a genetic disorder known as CADASIL, or cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy that affects blood flow in the brain, contributes to that risk. Race. The AHA reports that African Americans are more likely to die from stroke than Caucasians. Part of that is undoubtedly due to socioeconomic factors, such as inadequate access to health care. But the AHA also links this elevated risk to higher rates of high blood pressure, diabetes, and obesity within the Black community. Gender. Stroke kills more women than men, and women have more strokes than men. Medical history. Individuals with a personal history of stroke and/or transient ischemic attacks, often referred to as mini strokes, are at elevated risk for stroke. Risk factors you can control. High blood pressure. The AHA defines high blood pressure as the most significant controllable risk factor for stroke. Annual well visits are vital to preventative health care, which include monitoring blood pressure. When doctors diagnose high blood pressure, individuals should follow their advice to get their blood pressure back to a healthy level. Smoking. The dangers of smoking are well documented. The AHA characterizes smoking as paving the way for stroke. Never smoking or quitting smoking immediately can lower the risk of stroke. The AHA reports that the use of birth control combined with cigarette smoking can greatly increase the risk of stroke. And diabetes. It's important that individuals with type 1 or 2 diabetes control their blood sugar, as diabetes mellitus is an independent risk factor for stroke. Diet. A poor diet high in saturated fats, trans fat, sodium, and cholesterol elevates the risk for various conditions, including high blood pressure and obesity, that increase the likelihood of suffering a stroke. Physical activity. The AHA reports that physical inactivity increases risk for stroke. Individuals leading predominantly sedentary lifestyles, including office workers, are urged to discuss exercise with their physicians. There are numerous risk factors for stroke, many of which are beyond individuals' control. However, recognition of these risk factors is often the first step towards adopting a healthy lifestyle that can greatly reduce the chances a person will suffer a stroke. Learn more at stroke.org. Stroke, what you need to know. Courtesy of the American Heart Association and the American Stroke Association. Stroke affects the arteries leading to and within the brain and is the fifth leading cause of death and a leading cause of disability in the United States. It occurs when a blood vessel carrying oxygen and nutrients to the brain is either blocked by a clot or bursts, preventing the brain from receiving the blood and oxygen it needs, and causing brain cells to die. Types of stroke. Stroke can be caused by a blood clot that obstructs blood flow to the brain, ischemic stroke, or by a ruptured blood vessel that prevents blood flow to the brain, a hemorrhagic stroke. A TIA, transient ischemic attack, or mini stroke, is caused by a temporary clot. Ischemic strokes, or clots, account for 87% of all strokes and occur when a blood vessel supplying blood to the brain is obstructed. About 1 in 3 ischemic strokes is cryptogenic, and the cause is unknown. The incidence of cryptogenic stroke is 2 times higher in African Americans, and 46% more likely in Hispanics. Possible hidden causes include irregular heartbeat, heart structure problems, hardening of the arteries, and a blood clotting disorder. Hemorrhagic strokes or bleeds occur when a weakened blood vessel ruptures. The 2 types of weakened blood vessels that usually cause hemorrhagic strokes are aneurysms and arteriovenous malformations, or AVMs. The most common cause of hemorrhagic stroke is uncontrolled high blood pressure. Brainstem strokes occur in the brainstem and may affect both sides of the body, leaving someone in a locked-in state and generally unable to speak or move below the neck. TIA, transient ischemic attack, also called a mini stroke, is caused by a serious temporary block. TIAs are warning signs of a stroke and should be taken seriously and require immediate medical attention. Quick stroke treatment can save lives. If you're having a stroke, it's critical that you get medical attention right away to help minimize the long-term effects and even prevent death. Thanks to recent advances, stroke treatments and survival rates have improved greatly over the last decade. The only FDA-approved treatment for ischemic strokes is alteplase IV, RTPA, also known as tissue plasminogen activator, which works by dissolving the clot and improving blood flow. If administered within 3 hours and up to 4.5 hours in certain patients, the treatment may improve a person's chance of recovery. Other stroke treatment options involve an endovascular procedure to remove the clot by sending a catheter to the site of the blocked blood vessel in the brain. Sometimes these procedures involve administering tissue plasminogen activator directly into the blood clot to help dissolve the blockage. In other procedures, the doctor may attempt to remove the clot. Research is ongoing to determine the best clinical protocols for endovascular procedures. Learn more about stroke at www.stroke.org. Understanding PTSD and the emergent role of ketamine assisted therapy. Experiences such as combat, sexual assault, or serious accidents are widely recognized as life threatening events that can result in significant trauma. However, trauma can also stem from less obvious experiences that cause deep emotional wounds, such as emotional abuse, neglect, or growing up with a caregiver struggling with addiction or mental illness. When a child experiences these situations, the result can leave lasting scars that over time may contribute to post-traumatic stress disorder, PTSD, a condition that affects how we think, feel, and respond to the world long after the original event has passed. PTSD often manifests in several recognizable ways. One is intrusion, in which memories of the traumatic event return suddenly and intensely, such as flashbacks, accompanied by powerful emotions or physical reactions triggered by sights, sounds, or situations associated with the trauma. Another is avoidance, in which individuals block out memories of the trauma or feel emotionally numb. Others avoid certain places, activities, or relationships that remind them of what happened. Sometimes people attempt to manage these feelings with alcohol or drugs, which can create additional challenges. Trauma can also produce hypervigilance or hyperarousal. Individuals experiencing hyperarousal may constantly scan their environment for potential danger and react strongly to sudden noises, movements, or unfamiliar sensations. A heightened state of alert can lead to chronic anxiety, panic, and difficulty sleeping. Many trauma survivors also struggle with depression, anger, or persistent anxiety. While medications such as antidepressants may help relieve some symptoms, they often treat the effects of trauma rather than the trauma itself. Such conventional psychiatric medications primarily work by adjusting brain chemistry, often increasing neurotransmitters such as serotonin. While they can help reduce symptoms, they often do not address the deeper emotional patterns formed by traumatic experiences. In recent years, ketamine-assisted psychotherapy, KAP, has emerged as a promising option for people whose symptoms persist despite traditional treatments. KAP approaches healing differently. Administered in a carefully monitored clinical setting as part of a structured psychotherapy process, ketamine can help individuals access emotions, memories, and insights that may be difficult to reach through talk therapy alone. Many clinicians believe that meaningful healing from trauma often requires an experience powerful enough to reshape how traumatic memories are understood. Preparation is an important part of this process. Patients typically begin by setting an intention, a focus on what they hope to explore or heal during the session, which helps guide their therapeutic experience. After the ketamine session, patients engage in integration an essential stage of treatment. Through reflection, journaling, and follow-up discussions with a therapist, individuals work to understand the insights that emerge during the experience and apply them to their life. Ketamine-assisted psychotherapy is not appropriate for everyone, and a thorough medical evaluation is required before treatment. For many individuals living with PTSD, KAP offers a hopeful new path that aims to manage symptoms and support deeper healing from trauma. If you think that you or a loved one may benefit from a ketamine-assisted therapy, learn more at www.gregoryloewen.com. GregoryLoewen.com, or call 509-844-8474. 509-844-8476. You are listening to a reading of articles and features from Healthy Living on the Niagara Frontier Radio Reading Service. Seniors can benefit from looking after their grandchildren. Modern seniors spend a lot of time with their grandchildren, much of it caring for them, which may benefit grandparents in unique ways. According to the National Poll on Healthy Aging from the University of Michigan's Institute for Healthcare Policy and Innovation, 8% of grandparents provide care for their grandchildren daily or nearly daily. 1 in 5 grandparents reports caring for one or more grandchildren at least once a week. Though it can be a tall order for grandparents to care for their grandchildren, the time they spend with their grandchildren can offer unique benefits. The National Poll on Healthy Aging found that 72% of people with grandchildren reported they rarely feel isolated, compared with 62% of those who's without grandchildren. The poll also found that 13% of seniors without grandchildren reported their mental health was fair or poor, while just 9% of seniors with grandchildren described their mental health that way. Grandparents spending ample time with their grandchildren may also help strengthen social and cultural connections between them and their grandkids. The Healthy Aging Poll found that slightly more than 6 in 10 grandparents reported sharing at least one meal with a grandchild or grandchildren in the previous month, and nearly half reported preparing food for them. In addition, 36% of grandparents reported baking or cooking with their grandkids in the previous month. One researcher who worked with the team behind the poll noted that eating and cooking with grandchildren offers grandparents an opportunity to pass down knowledge and recipes for younger generations. Caring for grandchildren can be a significant challenge for grandparents. However, seniors who provide this kind of care can gain in special and meaningful ways. Could inflammation be driving your pain? Pain is often the body's way of signaling that something isn't quite right. While injuries or overuse are common causes, researchers increasingly recognize that chronic inflammation may also contribute to ongoing pain and other health concerns. Inflammation is part of the body's natural healing response. When tissues are injured or exposed to infection, the immune system sends specialized cells and chemicals to the affected area. This process helps protect the body and initiate repair. Normally, inflammation subsides once healing occurs, but sometimes inflammation persists at low levels throughout the body. This condition, often referred to as chronic or systemic inflammation, has been linked to symptoms such as joint and muscle pain, headaches, fatigue, digestive problems, and brain fog. Many factors can contribute to chronic inflammation. Poor sleep, high stress, physical inactivity, smoking, and diets high in processed foods are all associated with increased inflammatory activity. Over time, persistent inflammation has also been linked to conditions such as arthritis, heart disease, and certain autoimmune disorders. Because inflammation can have many triggers, addressing it often requires a comprehensive approach. Physicians frequently recommend strategies such as improving sleep, managing stress, increasing physical activity, and adopting a diet rich in fruits, vegetables, whole grains, and healthy fats. Some patients also benefit from supportive therapies such as physical therapy, massage therapy, acupuncture, or stretching programs to improve mobility and reduce discomfort. At Envision Health Functional Medicine, we focus on identifying potential sources of inflammation and developing personalized treatment plans that may include lifestyle strategies, nutritional guidance, and interactive therapies to support the body's natural healing. For individuals experience persistent pain, exploring possible inflammatory triggers with a healthcare professional may be an important step towards long-term relief. Notable mental health disorders and how to spot them. Mental health disorders are more common than people realize. According to the National Alliance on Health Illness, NAMI, 1 in 5 adults in the U.S. experiences mental illness yearly. This data confirms that mental health issues do not discriminate. Anyone, regardless of who they are or where they live, can experience a mental health problem or illness. According to NAMI, mental health conditions are not the result of a single event. Researchers have linked mental health conditions to factors such as genetics, environment, and lifestyle. Mental health conditions can also be as different as the people who experience them, which is why it can be helpful to learn about some notable disorders and how to spot them. Anxiety disorders. NAMI reports that anxiety disorders are the most common mental health concerns in the U.S., affecting more than 40 million adults. There are various types of anxiety disorders, but they all involve a persistent and excessive fear or worry in non-threatening situations. Emotional symptoms of anxiety disorders include feelings of apprehension or dread, feeling tense, jumpy, restless, or irritable, anticipating the worst, and looking for signs of danger. Physical symptoms may include a pounding or racing heart and shortness of breath, sweating, tremors, twitches, headaches, fatigue, insomnia, upset stomach, frequent urination, or diarrhea. Bipolar disorders. Bipolar disorder produces dramatic shifts in a person's mood, energy, and ability to think clearly. Bipolar disorders cause extremely high, or mania, and low, or depression, moods. NAMI notes that 83% of bipolar disorder cases are classified as severe. During an episode of mania, a person may rapidly become more irritable and their behavior more unpredictable, affecting their judgment, often resulting in impulsive, reckless decision making. During a depressive episode, people may have difficulty falling and staying asleep, though some may sleep much more than usual. NAMI notes that even minor decisions, like what to eat for dinner, can seem overwhelming during a depressive episode. Post-traumatic stress disorder, PTSD, affects about 9 million people in the U.S. Traumatic events like accidents, assaults, or serving in combat can create long-term responses, resulting in a diagnosis of PTSD. Symptoms of PTSD are typically classified into categories like re-experiencing type symptoms. These may be recurring involuntary and intrusive distressing memories, which can include flashbacks and bad dreams. Avoidance. People may avoid places or objects that remind them of the traumatic events. Cognitive and mood symptoms. Individuals may have difficulty recalling the events, negative thoughts about themselves, guilt, numbness, and worry. Arousal symptoms. Hypervigilance can cause individuals to be intensely startled by stimuli that resemble the trauma. No one is immune to mental health disorders, and your local NAMI affiliate is here with support, education, and advocacy. For more information about NAMI Buffalo and Western New York, visit NAMIBuffaloNY.org. If you or a loved one is experiencing a mental health crisis, dial 988, the National Suicide and Crisis Hotline. You are listening to a reading of articles and features from Healthy Living on the Niagara Frontier Radio Reading Service. Caring for our communities, one home at a time. May is National Nurses Month, a time to recognize the vital work nurses do every day. Many people think nursing only occurs in hospitals, but some of the most meaningful care takes place in people's homes. Over a century ago, Lillian Wald, who grew up in nearby Rochester, helped transform nursing. As America's first public health nurse, she brought care to homes and communities. She understood that health is shaped not only by medicine, but also by where people live. Today, nurses across Western New York continue that work, meeting people where they are, often in their homes. The need is growing. Home care across New York has increased by 26%. I have seen this firsthand. I began my career 25 years ago as a home health aide, and it changed how I understand care. In someone's home, you see more than medical needs. You see daily routines, challenges, and support systems. At VNS Health, We look beyond a diagnosis. We ask, is this person safe? Do they have food? Do they understand their care? Real care begins here. This work requires skill, compassion, and flexibility. As Catherine Hubush, Director of Clinical Operations at Elderwood IPA, which manages care for many of our health plan members in Western New York, says, as a social worker and a Buffalonian, it is a privilege to collaborate with members as they focus on maintaining their health and independence at home. In this role, you are not just part of a care team. You help individuals preserve not only their health, but also their dignity and quality of life. Community health nursing is more than a specialty. It is a lifeline for our communities. Partnering with a trusted network of providers, including Elderwood IPA, VNS Health offers Medicare and Medicaid health plans designed to help older New Yorkers live, age, and recover in the comfort of their homes and communities. Learn more at vnshealthplans.org. UV exposure and eye health, courtesy of Eye Care Vision Associates. Ultraviolet radiation from the sun can be harmful. UV rays have been linked to various skin cancers, including the dangerous melanoma. However, UV exposure can also affect other parts of the body, including the eyes. The American Academy of Ophthalmology says everyone's eyes are at risk of damage from UV light, regardless of age or skin pigmentation. The physicians at Eye Care Vision Associates, ECVA, agree and note that some people, such as children, are at even higher risk because they often play outside. Some studies also show that people with eye diseases like retinal dystrophy or those who have undergone cataract surgery may be at higher risk for sun damage. As a result, the physicians at ECVA offer the following information to help Western New Yorkers better care for their eyes this summer. UV light and eye disease. UV light damages eye cells, particularly in the retina, which captures light entering the eye and translates it into images. Damaging the retina can result in impaired or lost vision. UV radiation is also associated with additional eye disorders. Photokeratitis, the equivalent of a sunburn on the surface of the eye. Photokeratitis can occur when the summer sun reflects off snow or light-colored pavement, and may also occur at other times of the year. Cataracts. UVB radiation can damage the eye's lens and its proteins, which over time can cause proteins to clump together and form cataracts. Conjunctival cancer. This is a form of cancer that develops on the surface of the eye. Macular degeneration, a leading cause of central vision loss among older people. Macular degeneration affects the macula located at the center of the retina. Protect vision. Fortunately, it is easy to protect the eyes from UV rays. Individuals with blue or green eyes should keep in mind that they are at a high risk of UV damage. However, everyone should take precautions. Look for sunglasses that block UVA and UVB rays. altering 99 to 100% protection, offering 99 to 100% protection, or a UV 400 rating. UVA rays harm central vision, while UVB rays can damage the front of the eye. Sunglasses should be worn when outdoors and are available in all sizes, even for kids. Wraparound glasses may protect the eye and sides of the face. Wearing a wide-brimmed hat can also protect the eyes by filtering harmful light. Select a hat with a broad, dark brim that shades the eye and reduces glare. Consider using UV blocking contact lenses. Some contact lenses offer UV protection, which can be an added precaution when used with sunglasses. Another way to reduce UV-related eye risk is to avoid tanning booths, mercury vapor lights, and certain types of halogen or fluorescent lights. To learn more about UV eye damage and how to prevent it, visit ecvaeyecare.com. How to recognize mental fatigue. Everyone feels tired at some point. The signs of physical fatigue are often easy to recognize. Slower movements, heavy eyes, achy muscles, and even frequent yawning are some telltale signs that a body is tired. But what about mental fatigue? WebMD notes that mental fatigue affects the mind instead of the muscles. That can make mental fatigue difficult to spot. But identifying the presence of mental fatigue is important, as untreated mental fatigue can affect decision-making and performance at work and in the classroom. Anyone can develop mental fatigue, but those who find themselves frequently overwhelmed by work, school, or personal obligations may be particularly vulnerable. Recognizing the following signs of mental fatigue may prompt those experiencing such exhaustion to take a break and seek help. Mood changes. People experiencing mental fatigue may go through mood shifts that are uncharacteristic of them. Signs include increased irritability, a shorter temper, less patience for others, and more frequent snapping at people, all of which suggest mental fatigue. Loss of productivity. A noticeable decline in productivity is another sign of mental fatigue. WebMD states that loss of productivity from mental fatigue occurs because tiredness impairs a person's ability to concentrate. Mental fatigue can also sap a person's motivation. Distinctions become harder to ignore when mental fatigue sets in, further reducing productivity. Instances of zoning out. Mental fatigue can impair a person's ability to concentrate on what they're doing. This feeling of zoning out can be especially dangerous, as it can occur even while driving. In fact, WebMD notes a link between mental fatigue and car accidents. Inability to sleep. It may seem counterintuitive that mental fatigue would make it hard to sleep, but it can. People with mental fatigue may struggle to wind down and stop thinking about work or school-related tasks at bedtime. That can trigger insomnia. One danger of this side effect is that a lack of sleep can worsen feelings of exhaustion. Increased anxiety. WebMD notes that mental fatigue activates the sympathetic nervous system, which can cause feelings of anxiety and panic. These feelings may be constant. Physical side effects. Some people find it harder to exercise when their minds are fatigued. A 2017 study in the journal Sports Medicine found that the duration and intensity of a physical task are key factors in assessing how mental fatigue affects physical performance. Researchers identified a shorter time to physical exhaustion and a subsequent decline in endurance performance as side effects of mental fatigue. Mental fatigue can take a serious toll. Anyone who suspects they are suffering from mental fatigue is urged to contact a healthcare provider. What causes fibromyalgia? Widespread muscle and joint pain can significantly disrupt daily life. When this pain persists, it may be caused by a condition called fibromyalgia. The Mayo Clinic says fibromyalgia is a chronic condition that is often accompanied by fatigue and may even affect memory, mood, and sleep. People with fibromyalgia may go through periodic symptoms such as flare-ups. Navigating fibromyalgia can sometimes be overwhelming and exhausting, according to the Cleveland Clinic. The time between feeling good and suddenly experiencing a flare-up can lead to anxiety and hopelessness. Experts aren't exactly sure what causes fibromyalgia. The Centers for Disease Control and Prevention says people aged 30 to 50 are more likely to develop the condition. Women, those with family history of fibromyalgia, and individuals with lupus, rheumatoid arthritis, or osteoarthritis also have a higher risk of developing fibromyalgia. Doctors know that symptoms often follow a triggering event. Triggers may include surgery, infection, injury, or emotional stress. The Cleveland Clinic states that people with fibromyalgia are usually particularly sensitive to pain. It is believed that genetic mutations responsible for forming the neurotransmitters in the brain that receive pain signals might cause fibromyalgia, although a direct link has yet to be identified. Fibromyalgia is typically diagnosed through a physical exam, X-rays, lab tests, and an evaluation of a person's medical history. There is no cure for fibromyalgia. Healthcare providers manage symptoms with medications and therapy. People with fibromyalgia might find ways to control their symptoms on their own. Cognitive behavioral therapy, which alters how people think or act, can also help individuals cope with fibromyalgia. You have been listening to a reading of articles and features from the May issue of Healthy Living. Your reader has been Janice. Thank you for listening.